This is a story that you do not want to miss. What if your genes could help unlock the future of Alzheimer's? There is a groundbreaking Houston study exploring whether Alzheimer's is actually several different diseases and how that could change how we predict and treat it. So joining us now is Dr. Joshua Schulman with Texas Children's Hospital and Baylor College of Medicine, who is leading the study, and Judy, who is one of the participants in the study. So thank you so much both for coming in this morning. Wonderful to have you. Dr. Schulman, first of all, let's talk about this. What inspired you to look at whether Alzheimer's might be different diseases that we're kind of lumping into one umbrella category?
Yeah, I mean, I'd say a couple of things, but the most important factors are, and I often tell my medical students and neurology trainees this, if you've seen one patient with Alzheimer's disease, you've probably only just seen one patient with Alzheimer's disease. Mm-hmm. Every single patient is quite different in terms of the age of onset, the symptoms they develop and present with, their response to the available medications that we have. There's lots of variability. And another important inspiration has been autopsy studies that look at brains from individuals who die with Alzheimer's disease. What these studies have found, although neurologists are usually correct with the diagnosis and will find the brain changes of Alzheimer's when they look at the brain, usually they will additionally find other brain changes that can independently cause dementia or cognitive impairment in combination with Alzheimer's disease. So what we've learned is that Alzheimer's disease is really due to these mixtures of different brain changes.
Okay, and so I think that's what helps to explain why we might be wanting to think of this differently. Judy, share with us why you decided to join this study and tell us a little bit about your story.
Well, I'm participating with this study because my mom has Alzheimer's dementia. I've been participating with this program for about 5 years, but I'm not quite sure when my mom was exactly diagnosed or when she started exhibiting her symptoms, but it's been about 7 to 8 years or so. It gives me the opportunity to learn more about how to help her, how to treat her. And
ultimately how to help and treat yourself as well, right? I mean,
yes.
When you have shared your genetics and so you want to know better how this impacts your whole family.
I certainly do. It's scary at times when I think about it, and I have 2 daughters and I'd love for them not to have to experience this, but at the same time I'm trying to make sure that I'm addressing all of my mom's needs because she has changed a little bit from where we started. But the disease itself is unimaginable. So I want to make sure that no one else has to go through this disease.
Well, thank you for participating so that you are adding to the knowledge that we have, and we know that knowledge is power. What are participants, Dr. Schulman, learning about their own risks through this study? I mean, this is a great example.
Yeah, well, first of all, I want to thank Judy for coming on and helping to share her experience. I mean, first of all, some people that we're taking into the study are discovering that they have the very earliest symptoms of Alzheimer's disease and didn't even know about it. This is incredibly important because we now have treatments for Alzheimer's disease that are effective, but they're only going to be effective if they're given at the earliest possible moment, so the earliest symptoms. In other people, we're finding early changes of Alzheimer's disease from the blood or neuroimaging of the brain, like brain MRI and PET scans, before any thinking or memory problems have even begun. And those people are now eligible for clinical trials of preventative therapies, which are incredibly exciting in the field. And then lastly, like you asked, we're identifying some people who are at increased risk. And we're able to give those people back information about their genetic risk factors that might explain why Alzheimer's has passed down in their families.
Yeah, because there is a genetic component in some cases, not all the time.
I would say in most cases there's a genetic component, but it's usually not a single gene with a very strong effect, but rather it's a combination of genes with individually small effects.
Okay, and that goes back to that different family of diseases as well.
Exactly. There are more than 100 different genes that have been discovered to be important in Alzheimer's disease, and in each person there's probably a different combination. We're even finding incredible links between childhood genetic disorders and late in life neurodegenerative diseases like Alzheimer's and Parkinson's Parkinson's disease. And this is why it's so valuable that we're able to study that whole continuum at the Duncan Neurological Research Institute in Texas Children's Hospital.
Wow, okay. And let's also ask Judy, what would you want to share with those who are beginning a caregiving journey for somebody who has Alzheimer's? How do we make the most of our time with a loved one? What insight or advice do you have to share?
Take a deep breath and breathe. That's the first thing. Continue to love your loved one. Listen to them. Notice the little changes. If you think something may be wrong, ask questions. Don't be afraid to. And just ask, talk to other people. Participate in programs like this one. Make sure that you just have a good understanding of who your loved one is and the changes that has come into their life since then.
Well, we appreciate it. This is just the beginning of the conversation. Dr. Schulman and Judy, thank you for joining us.
Thank you so much for having us.
All right, more to come. We're going to take a quick break. We'll be right back.